a carer for someone who has cancer, these are the two main reasons that people end up in A&E. I'm Zeinab, I'm the pharmacist from PillSorted, and these are the practical tips that we covered in the carers group in the Cambridge Cancer Help Centre. This is one of the parts that I really enjoy, seeing people in their support groups. They're going through the same journey. This group were a wonderful group of carers that were supporting people with different kinds of cancer. And there were a couple of practical tips that I covered. So there's two things that are really, really important for anyone who's caring for someone with cancer. And those are the things that we never want to see as a carer, right? We don't want to see our loved ones ending up in hospital. So if you take care of these 2 points, you're going to be much better off versus all the, 1001 different things that carers want to check and be careful of. The number one reason, especially for people of older than 60, is falls. Okay, that's the number one reason that people end up in A&E. There's lots of different reasons that people might have a fall, but one of the most common ones is actually in the toilet. So it might be for two reasons. One is if they get constipated, that strain that it brings to get relief from constipation can cause a dip in the blood pressure, which means if they try to stand up, it will make them faint. Okay, that's one of the reasons that falls happen. The other one is if the medication is causing them having to wake up from sleep a couple of times per night to go to the toilet, they're still sleepy. When you're still sleepy, there's more likely that you might have a little bit of a dizzy spell and fall. So that toilet activity is really important. That's why constipation relief is so important. That's why checking the medication so that you can get a good night's sleep is super important. So that's one of the main reasons falls. The other things that can help prevent falls happening is not having anything loose on the floor, loose pieces of rug, loose pieces of furniture. Anything on the floor can become a hazard for falling. The other one is footwear. So footwear is really important. I don't know if you've seen or not, but Crocs have taken up the healthcare professionals because they are quite ergonomic. Your feet don't get tired. They get strapped at the back of your foot, so they're not loose and they're easy to walk around with. This sort of footwear is really important. So footwears that are open at the front or open at the back or loose can make you have trips much easier. So these were the practical tips about it. The other important reason for A&E for cancer is actually infection. When you're going through different chemotherapies or different cancer therapies, it can reduce your immunity, and the infection signs might not be that clear. Okay, so it's sort of we built in that it has to show with high temperature. Actually, high temperature is not one of the first symptoms of infection. In people with low immunity and older age, most of the time infection symptom is actually confusion. So if they don't feel with it, if you talk to them and they answer something random, or if they're slurry in their speech, these are more signs of infection. So if you combine that, plus you feel that their breathing is slightly faster than their usual. Okay, so these are quite subtle. A bit of confusion, a bit of faster breathing. So watch out for these. It might have a raised temperature, it might not actually have a raised temperature. But in this case, it is better to get it checked sooner rather than later. So these were the practical tips that I covered. Now let's go to the question and answer. So one of the questions was, why do infections keep happening? My house is spotless. I understand that frustration, okay, that you feel that you're doing everything right, but still these infections keep coming up. Well, it's not your fault. Our body is full of bacteria. There's so many different bacteria, fungi, viruses that live on our body regularly. When our immune system is lowered because of the different therapies, any of these can become more active and grow faster. So even if you make the whole outside of your body 100% without any bacteria, which can't happen, your body is full of it as well. So my point is, it's not your fault, okay? Of course, keeping clean, try to have less exposure is a good thing to do, but it is expected when you're going through different therapies that can affect your immune response. Things that really help: washing your hands really carefully, all of your fingertips, having your own specific tableware. These do have a big effect, okay? And try to have cooked food, most of it. Raw food might have more of the bacteria that can start growing too much and cause infection. The other question was about steroids. So one lady was taking steroids for a very long time, and she wanted to know what are the things that she needs to look out for. Steroids are anti-inflammatory medications. They're amazing at reducing the inflammatory markers in our body, especially for things like rheumatoid arthritis. They really help reduce the inflammation. Now, the important thing is to find that minimum effective dose of the medicine, because long-term effect of it can affect your bones, okay? So the most significant effect it does cause bone thinning. There's lots of medications that can help support and make it less, okay? So first of all, there's the calcium and vitamin D. Make sure that you get that from the doctors. The other ones are the bisphosphonates. These would be the first line. Things like alendronic acid or risedronate. These are once weekly. They slow down the bone loss, okay? There are more specialized treatments as well that help reverse this bone loss. So we've got lots of different options, okay? Other things that you need to look at is the skin becoming thinner. If you use it as topical, especially for a long term, it can also affect all the other hormones. Like it can affect your sleep. There are two things that are important. If you've been on the long term, you don't want to stop it suddenly. There's a really important tapering down procedure, and stopping is really important to do it carefully with your prescriber. The other one is it's really important to have your steroid card with you, okay? That does affect how any new treatment will be added onto your current medications. Another question was about azathioprine. So question was, is this a chemo drug as well? Okay, now it's a cytotoxic medication, but what it does, it helps calm down the overactive immune system, okay? So it's called an immunosuppressant, and it is quite effective to calm down the immune inflammatory markers. It helps improve the symptoms that you're having. So long-term precautions of azathioprine is you do need to do regular blood tests, because we want to make sure that your blood functions are not affected for long term too much. And again, it does cause you having a lower threshold to infections, so you need to be mindful of that. Also, skin. Your skin becomes sensitive. Make sure that you cover your skin, have a good sunscreen, and wear a hat during the sunny times. Now, I want to add I talked about the important things that carers look out for, but I want to finish about caring, okay? This is a very important thing that you're doing. It takes a lot, okay? Just these couple of tips would help you be much more prepared and take off the edge throughout your busy days. One is have a current list of all the medication. This is so helpful, especially if you need to jump through hospital to GP surgery to a carer you want to show. That list of medicine is such a lifesaver. It's one of the most important things that we started from with PillSorted as well. So when you take your medication, what they look like, these are really essential. They are lifesavers, and don't take it that people know as a healthcare professional exactly what's going on, okay? So you having that list is really important. And I'll show you as a PillSorted patient how you can print that list of medication for yourselves. But list of up-to-date medicine is really important. The other one is make sure you take care of yourself. This is something that we overlook so much, but it's really important to think about yourself. Take breaks regularly, make sure that you keep hydrated and have plenty of nutrition, and make sure that you keep up with your own health. Create that supporting group for yourself. So these carer groups are amazing. It's a place that you can share things that have worked for you or concerns that you have, and it really preventing burnout. So burnout is real. It's really hard to take a time off when you're constant 24/7, but it's really important for your long-term health to be able to do that, okay? So monitor yourself, take the breaks, and make it manageable. Also, Make sure that you've got all the details that you need at hand. So if it's like the 111 that you go out for the first point, usually there is a cancer consultant group that asks you to be there first line. Have those details very close by, that if there's times that you want to have a quick question, you know where to get the answers from. As a recap, the two most important points that as a carer you need to be mindful of is falls and trips, and the other one is infection. If there's any questions that you've got, subscribe to our channel, reach out to us. We're here for that clinician-led health advice, and we can get you the best support you need. Thank you.